Hello friends, it's Dr. Pawan Prasher. I'm a cornea consultant working in Amritsar, and today we are going to talk about dry eyes, which is one of a very common disease entity encountered in our day-to-day practice and which can have serious adverse effects on any individual suffering from it. So let's first try to understand what is dry eye. Our eyes need tears to stay healthy and comfortable. Normally our eyes constantly make tears to stay moist. When we blink, a film of tears spreads onto the eye to keep the eye surface moist and or to keep the vision crisp and clear. If your eyes do not produce enough tears, it is called dry eye. It is a very common condition not just in Indian population but all over across the globe. So what are the causes of dry eye? First is aging. People tend to make fewer tears as they get older due to hormonal changes, and this is especially more common in women after the menopausal age. Another important cause in today's life is extensive use of digital screen devices like computers, laptops, smartphones, and people who tend to work for a prolonged period of time are known to have reduced blinking rate, which leads to increased evaporation of the tear film, and this aggravates the dry eye. Also, people working in conditions which is where there you have excessive smoke, lot of wind or dusty or dry climate are known to have more chances of dry eye. Certain systemic diseases like rheumatoid arthritis, Sjogren's syndrome, and thyroid diseases are also known to be associated with dry eye. Use of certain systemic medications like anti-allergics and antipsychotic medicines have also been known to be associated with increased chances of dry eye. And people undergoing refractive surgery also need to be careful, as these procedures are known to be associated with increased chances of dry eye in their postoperative period. Now, what are the symptoms of dry eye? You feel like your eyes are stinging or burning, and people also complain of blurring of vision, especially while reading. And there may be a scratchy or gritty feeling like there is something in the eye. And quite often you have mucoid discharge or strings of mucus coming from the eye. The eyes may be red or irritated, and this usually worsens when you step out in a windy or smoky environment, and it may be painful to wear the contact lenses, and in some subset of individuals there is paradoxically increased watering as a result of reflex secretion, although the underlying cause is dry eye. So how is dry eye diagnosed? There are many different tests when you come to an eye clinic. The ophthalmologist may have you undergo various tests to measure whether you have enough tear secretion to keep your eye moist and healthy, and there may be other tests that measure the quality and thickness of your tear film. So how is dry eye treated? The mainstay of the treatment, especially in the early stages, include replacement therapy, where your tear film is replenished with artificial or lubricating eye drops. These are the eye drops which are just like your own tears, and quite often we may prescribe other adjunctive therapy which help to make more of your own tears. And quite often the ophthalmologist may suggest that your tear ducts may be blocked by tiny silicone or gel plugs which are known as puncture plugs. They are inserted in the tear ducts that can be removed later as needed. And in some of these individuals, we may suggest or we may recommend surgery that permanently closes your tear ducts, so that whatever little tears are being produced, they stay on your ocular surface a little longer and the patient feels symptomatically better. And also quite often we offer or we recommend adjunctive supportive therapy like warm compresses on the eyelids, massaging of your eyelids, and certain eyelid cleaners, especially if there is associated blepharitis or dandruff or infection of the eyelid margins. And lifestyle changes are also recommended, and they are very helpful in most of the individuals. So you need to look out if something in your life or environment is causing your dry eye or it's making it worse, Your doctor may suggest changes to help protect your eyes, like you may be recommended change of the medicines which cause the dry eye. Try to avoid smoke, wind or air conditioner or fan. They should not be directly hitting you or in your face, or they shouldn't be blowing into your eyes. Use of a humidifier to keep the air in your home from getting too dry. It's very highly recommended that you should limit your screen time and take frequent breaks from staring at the screens for too long. If you are a professional who cannot do away with your digital screen price, it's very important to take frequent breaks and give your eyes rest. Wear sunglasses when you are outside. Drink plenty of water, 8 to glasses every day, and try to get enough sleep. At least 7 to 8 hours of a good quality sleep is very necessary to keep you healthy and keep your eyes healthy. In the end, I would like to emphasize that please do not ignore your symptoms. Consult your local ophthalmologist if you have any of the symptoms of dry eye we just discussed. And please do take care of your health and take good care of your eyes. And I'll see you in next video. Thank you so much for watching.